Are you suffering from burning, numbness, tingling, sharp shooting pain, maybe even a loss of balance? Are you wondering if you have peripheral neuropathy, or could it possibly be something else? Don't worry, because in this video I'll cover the key symptoms of peripheral neuropathy and what you can do about it. Hi, I'm Dr. Valerie Monteiro, a leading expert in the field of peripheral neuropathy and co-founder of the San Antonio Neuropathy Center, where I've been successfully reversing peripheral neuropathy for over 15 years. I also wrote the book, Defeat Neuropathy Now, in Spite of Your Doctor. I'm happy to share with you a 3-part video series that I want you to think of as a survival guide to neuropathy, because your peripheral neuropathy doesn't have to be a life sentence. So in this 3-part video series, we'll talk about what exactly peripheral neuropathy is and what the symptoms look like. We'll also talk about the 3 things about neuropathy you need to know. And in this segment, I'll cover the most common myths and misconceptions still being perpetuated. We'll also discuss peripheral neuropathy. It's not what you think. I'll cover many of the causes of peripheral neuropathy that you need to know about. And I'll also tell you what you can do to begin to reverse your own neuropathy and reclaim your life. First, I want you to know something personal about me. The subject of peripheral neuropathy is really near and dear to my heart because my own mother suffered from this debilitating illness. After undergoing chemotherapy, my mother developed a very severe case of neuropathy. Prior to developing the peripheral neuropathy, my mother was a vivacious woman. She was full of life and spirit. But all that quickly changed when my mother was reduced to using a cane and in constant agony from her symptoms. When I brought my mother to one of the leading neurologists, he told her that peripheral neuropathy is permanent and she'd just have to learn to live with it. But hey, she should be happy because after all, she'd survived the cancer. He then sent her on her way with some gabapentin. Well, there was no way that I was going to sit back and watch while my mother lost all quality of her life due to the neuropathy. So that drove me to do extensive research. I knew there had to be a solution. If doctors can reattach a severed limb and restore its functionality, hell, I knew there had to be a way to repair these damaged nerves. And after lots of research, I found it. I successfully reversed my mother's peripheral neuropathy. She was able to ditch her cane, get back into her high-heeled shoes, and dance again. Well, really just live again. So if you've been told that you just have to learn to live with your neuropathy, I don't want you to accept that. There is effective treatment for peripheral neuropathy that goes above and beyond merely covering up the symptoms with drugs like gabapentin, Lyrica, Cymbalta, or even tramadol. After all, these drugs are nothing more than a Band-Aid. Now, if you think you may have peripheral neuropathy but aren't really sure, don't worry, because today I'm going to describe what peripheral neuropathy is and what the symptoms of peripheral neuropathy look like. So first, let's begin with what is peripheral neuropathy. Peripheral neuropathy is a disorder resulting from damage to the nerves that go to the feet and the legs or the hands and the arms. This damage disrupts the normal function of the nerves, which can cause a couple of things to happen, like the nerves might send pain signals when there's actually nothing causing the pain. Or the nerves may lose their ability to send a signal at all, resulting in a deadened sensation or what we call numbness. Peripheral neuropathy will always affect both limbs at the same time. It may be both feet, or it may be both hands and both arms, or possibly both legs. But here's where it gets tricky. You could have 10 people in the same room suffering with peripheral neuropathy, and each of them might describe their symptoms differently. Why? Well, symptoms will be determined by where along the peripheral nerve the damage has happened. And each area of the nerve will cue a different type of symptom that's signaled to the brain. Not everyone's damage will occur in the same area of the nerve, and that's going to result in a multitude of different symptoms. So, I'm going to outline some typical symptoms that you might experience with peripheral neuropathy. For instance, a person could have numbness, burning, tingling, or a pins and needles sensation, while some people might experience an electric shock-like pain, which can also be described as a lightning bolt pain. Other neuropathy sufferers may experience a strong, dull, achy pain. In fact, my own mother described her symptoms as feeling like she was being bitten by a colony of fire ants. Some of our patients have said it feels like they're walking on glass. I even had one man walk into my clinic in November, and he was shirtless because the fabric rubbing against his skin caused him tremendous pain. We call that a sensitivity to fabrics. Many times people won't even be able to tolerate the weight of the bed sheets on their feet or their legs because it just causes too much pain. Still, another symptom neuropathy sufferers can experience is a loss of balance. Now, this is quite serious because frequently it'll lead to falls, some resulting in serious injuries and even hospitalization. In fact, we had one patient walking on a level parking lot who lost her balance for no reason at all. Well, she fell and unfortunately broke her hip. Other symptoms of neuropathy can also include chronic muscle cramping, muscle weakness, or muscle deterioration, which we call atrophy. Now, when you're suffering with peripheral neuropathy, you won't necessarily experience all of these things. You might start with only one or two of these symptoms, which may be very mild. The problem is, as humans, we generally brush off and ignore any symptom that's mild, especially if it's not stopping us in our tracks. However, as time goes on, these mild symptoms will worsen and intensify. They may even multiply, meaning you started off with only one or two symptoms, but several months or a year later, you're now experiencing 3 or more symptoms. So here's something I want to caution you about. Do not ignore these symptoms. Why? What's the big deal, you're wondering? Especially if you're still functioning just fine? Well, let me share a story with you of one of our patients. Larry had numbness in both of his feet. He couldn't really feel the floor when he walked, but he didn't think it was a big deal because it didn't slow him down or interfere with his daily life, so he chose to just ignore it. That was until one day when he was walking barefoot, and his wife noticed he had a thread on the bottom of his foot that he was dragging around. Larry didn't have the flexibility to remove the thread from the bottom of his foot, so he asked his wife to give him a hand. When she went to try to get the thread off of his foot, she realized that the thread wasn't coming off. And the reason it wasn't coming off was because Larry had stepped on one of her sewing needles that had penetrated his foot. The needle was deeply embedded in his foot, with the only thing showing was the thread that was attached to the needle or threaded through the needle. Now, I forgot to mention one very critical thing. Larry suffered from diabetes. So he went to the hospital to get the needle removed and the thread, and in the process, his wound got infected. As a matter of fact, Larry lost 2 of his toes to the infection. Now, believe it or not, this story could have been even more tragic because Larry came very close to losing his entire foot. So what I want you to walk away with from this story is take even mild neuropathy symptoms seriously. Your symptoms may be mild today, but they will continue to worsen with time. Numbness is one of the most common symptoms many neuropathy sufferers will start off with and ignore. Numbness can be serious because it can interfere with our body's survival and protection mechanisms. Let me share one more story with you so you can see what I mean. Our patient George lives in San Antonio, and the summer gets sweltering hot. In fact, it's very common for it to reach triple-digit temperatures from June all the way through September. Well, George walked from his house to his mailbox, which was just a few houses down the road and across the street. It was one of those community mailboxes. George didn't bother to put on any shoes because it was just a quick run to the mailbox. Well, that day, it happened to be 103 degrees outside, and the streets in George's subdivision were asphalt. What George didn't notice was how hot the street was that he was walking on. Did you know that asphalt can be anywhere from 40 to 60 degrees hotter than the surrounding air temperature? Well, George developed second-degree burns on both of his feet with severe blistering. Because of his foot numbness, he never felt how hot the pavement was. Now, both of these men ignored the mild numbness in their feet and ended up with severe injuries as a result. It was my mother's own battle with neuropathy that led us to develop NUPHORIA Gold. NUPHORIA Gold is a formulation of proven supplements that have been shown in clinical research to repair and reverse peripheral nerve damage. With NUPHORIA Gold, we wanted to accomplish a few goals. First, we wanted our formula to be able to diminish neuropathy symptoms like the ones I just went over with you. And secondly, we also wanted the formulation to have the ability to repair the damage to the peripheral nerves. So Dr. Coppola and I did extensive research to find out exactly which nutrients had shown the biggest impact on healing damaged peripheral nerves. And that's how we came up with our formulation. The ingredients in NUPHORIA Gold have been proven in hundreds of clinical research studies to diminish symptoms like burning, numbness, tingling, and many more, while repairing the damaged nerves so that you can recover from neuropathy. My mother made a full recovery from her severe neuropathy, and so have many of our patients. If you're tired of dealing with your neuropathy symptoms, give NUPHORIA Gold a try. You have nothing to lose. On the other hand, if it does work for you, think of what you have to gain, like eliminating your pain, getting back to golfing, gardening, dancing, playing with your grandkids, and even traveling. Don't you owe it to yourself to give this a try? If you're ready to retake control of your life and to stop living with the pain, the burning, the tingling, and the numbness that comes with peripheral neuropathy, then click on the link on the screen and try NUPHORIA Gold. Stay tuned for our next segment where I'll reveal the 3 things you must know about neuropathy. I'm going to share with you some shocking facts that will have your jaw hanging open. I look forward to seeing you on the path to great health. See you next time.